he's pretty stiff through his thoracic spine, okay, which so many of us are, I can help facilitate him by, let's have you cross your hands over your shoulders here. Let's do the other way. No, never mind, sorry. Other way. The other way. So I can get him in position, and I can do some active mobilizing. Different therapists like different hand placements. I like to come up through here, so they're crossed over me, but I can come right into a nice squat position, say lean forward onto my arm. Okay, so let me take your body weight and lean forward onto my arm. I can help facilitate some extension by doing this.
Are you under his right arm,
I
over
am.
his left?
I am over his right, under his left. So his left is crossed over me.
Okay.
There, you can play around with the different hand positions, but that seems to be most effective for me. Also, I'm not putting my hand directly over women's breasts in that position. And again, if I have someone who's bigger or I have more breast tissue, I can put a pillow between me and that patient here. But typically I have long enough arms that I can get right here and have them lean forward onto me and push. And even if I don't do that, I can still just come right here and push. And if you put your hand on the spine like this, you're going to have a nice little groove for the spinous process, so you're not pushing directly on the spinous process. So I can do a little bit of just that PA pressure again to help facilitate extension. And then also in sitting, I can do the same thing that I did in prone with pushing at the transverse processes. I can do that same thing either having him rotate as I'm pushing or coming behind and pushing spinous processes. Say CT junction here, I can come onto a spinous process and push it to the left if I want Brian to rotate right. I can also push on the transverse process to help facilitate him turning to the right. Okay, so think about what's happening at the spine. Okay, think about what's going on here. Lots and lots and lots of different ways to mobilize. I'll show you a couple other things in supine here in a few minutes, but